Hello, I'm Janelle Friesen. I am the Public Information Officer with the UG Public Health Department. It is October 1st, and this is our weekly video update. And Brandi is back to talk with us today. Do you want to say hello?
Hi, thank you for having me. My name is Brandi. I'm the site lead here at our Kmart location down at 78th and State in Wyandotte County. We have both vaccinations and testing here on site.
Great. Well, I'm excited to talk to you about COVID-19 boosters today. I know people have heard a lot in the news about how now there are some boosters available for some folks, but want to make sure we clarify what that looks like. So, can you start by talking about who is eligible for the COVID-19 vaccine boosters?
Sure, my pleasure. So, first of all, these boosters are only available to our patients who received first and second dose Pfizer vaccinations. This dose is for only people who are 18 and above, and it has to be at least 6 months after your second dose was given. It's for those of us who are 65 and above is easy. If you're 65 and above and you're 6 months out of your second dose of Pfizer, then you are welcome to come and get a booster. If you are between 18 and 64, the guidelines state that you should be somebody with an underlying medical condition, and those could be anything from cancer to pregnancy to obesity, diabetes, anything that puts you in a higher risk category for contracting COVID and a poor outcome if you were to get COVID. Also, for the 18 to 64 age range, specifically people who work in high density environments such as teaching, hospitals, healthcare workers, kind of those frontline workers that we saw in the beginning of the pandemic with their first and second doses.
All right, so that helps clarify who can get a booster, but why do we have boosters? Can you explain that a little bit?
That's a great question. So with any vaccination, over time, our immunity starts to wane. And in the beginning, we didn't know when does immunity wane when we first came out with these vaccinations. And so through all of the data that we have been watching with our patients who are still in our trials, we realized that about the 6 month mark is where we start to see immunity wane. And so that's why they decided with Pfizer, let's go ahead and get those boosters out there because immunity is starting to go down from the vaccinations that we got before. It's much like a tetanus shot. How every 10 years you need to get a tetanus shot. So same thing, just this is 6 months.
All right, so we know that this helps bring your immunity back up and we know who's eligible. What does this mean overall for fighting COVID-19 in our community?
So for fighting COVID-19, once we put people's immunity back up to where we need it to be, that will help us be better protected. It will help us see a reduction in breakthrough cases or what we call morbidity and mortality, bad outcomes through those breakthrough cases.
So we know that these boosters are an extra layer of protection. And of course, we still have a lot of people who haven't gotten first doses yet. Where can people access either their initial doses of the vaccine or a booster?
The first place you can come to would be us here at Wyandotte County. We are open. It doesn't matter what county you live in. It doesn't matter if you live in Missouri, Nebraska, Iowa. You can come see us here at our location at 78th and State. The actual address is 7836 State Avenue here in Kansas City, Kansas. Or you can go to vaccines.gov and find a location around you. There are many places that have our supply chain is wide open now. So you can go to Walgreens, Walmart, Sam's Club. Basically, anybody has a vaccine now. I do recommend that you look at vaccines.gov before you go, just to know whether you need to have an appointment or not. And then you can also filter it by type of vaccination. So if you want Moderna, you want J&J, you want Pfizer, whichever, you can filter those locations on that website.
All right, great. Well, I think this is a good overview, and we're going to link some more information in the description with this video so you can check that out. But thanks, Brandi, for talking to us about boosters.
Yes, thank you for having me.
All right, we'll see folks next time.
Thank you.